Well, let's get our next guest. Each and every Friday is kind enough to join us to give us insight on where we are each week at this time with the coronavirus, and that's Dr. Richard Pan joining us here on the show. Dr. Pan, how are you today?
Doing all right. How are you?
We are good. We're good. Thank you so much for joining us, and let's kind of start as we do each and every Friday with a progress report. I guess, 47, 48 states have eased restrictions. Certainly we've eased some things, but where are we now, present time, I guess, kind of on a checklist with coronavirus?
Sure. Well, as far as the state is doing overall, unfortunately, we have now hit over 3,000 deaths. We are flattening the curve, but it's sort of flat. It's not turned down statewide. We see more challenges, particularly in Southern California. But here in Sacramento, we continue to see a decrease in the number of people who are hospitalized or in the ICU because of coronavirus. So we are continuing to make progress. We are increasing testing. The county actually will test people who are asymptomatic through the Verily thing over at CalExpo. So hopefully, if you still have to do the questionnaire, but you qualify, you can get tested even if you don't have symptoms. We are, continuing to increase testing, which is going to be a very important step toward being able to further lift restrictions. And as you mentioned, there's been some increases in terms of people allowing to do a few more things, but we're certainly not out of the woods yet, but we are making progress here in Sacramento.
Question off the text line, and I think this is a very common question people have. Dr. Pan, if the stats are saying we're flattening or low in this county, that county, or in California in general, why the heck are we all still locked down?
Because, unfortunately, the virus is still out there. It's contagious, and if we lift the lockdown too quickly, then it will come back. And I would also point out that it's not like a light switch. Either you're locked down, you're not locked down, right? So what we have to do is that we lift things up slowly. We monitor what happens. It takes about a 2 or 3 week lag from when someone lifts something to a rise in cases. So you just have to realize that when you lift a restriction, then what will happen is that you'll see its effect 2 or 3 weeks later. It's not going to happen right away. What will happen is the virus will spread, and then people start getting sick because there's a incubation period. It's almost a week, and so forth. So it takes some time before you start seeing the effect in terms of the spread of the virus. And we saw that, of course, when the virus was coming over as well. I think what we don't want to have happen is to have the outbreak continue to run on and have trouble trying to contain it again.
Dr. Pan, I think it was, I don't know, forgive me if it could be 2 weeks ago Friday or 3 weeks ago Friday, we were on and Georgia was starting to ease things. And for the moment, things have been looking encouraging there, but are we far enough along there to make any assessment, or do we need more time there?
I think we need some more time. What we are seeing is there is a continuing rise in cases outside of the urban areas where we've been hearing the news, right? So when you saw the news about New York City and Detroit and New Orleans, and we've talked about this on this show, what we're seeing is now it's spreading out to other more suburban and even some more rural areas as well. So, and those areas are less dense. That's probably why it took more time for it to get to those areas. But what we are seeing is a continuing rise in cases, and that is basically tells you that we're not ready to let everyone just mingle. So I think that's something that we should keep in mind. Again, we need to continue to increase testing. Not testing doesn't mean the number of cases goes down, just means we don't know what's going on. And so that's why it's important to do that, so we have a good handle of what's going on. The other thing I should also point out is that even when lockdown is lifted, if we don't have a good idea of what's going on through testing and then being able to contact trace, people are still scared to go out shopping. So it's not as if when you lift the lockdown, everyone suddenly goes out. So you do see pictures of people filling bars or other types of things, but that's still a minority of people. In fact, polling shows that a vast majority, over 70% of people, Americans, are expressing that they don't want to go out. They don't want to go shopping. They don't want to do that. So even in places where they've lifted lockdowns, like in Georgia, a lot of people still aren't, and that does help slow the spread. But unfortunately, what happens is that it is going to spread more because you do have that minority of people now having the ability to go and spread the disease farther out in the community.
Dr. Richard Pan joining us, and as I've said before on the show, I fell in love with Dr. Pan with his work initially on vaccination legislation and all the work he's done there. So, right guy to ask here. I have a question and then a quick follow-up, if okay. Number one, let's say tomorrow, magic, snap your fingers. We have a vaccination that works. What is the correlation between what percentage of people would need to receive the vaccination for us to get to herd immunity? What's the correlation between vaccination amount and that herd immunity?
So the estimates are, in order to achieve what we call herd immunity or community immunity, we would need about 70% of people to be immune to the disease. Now, there's some things we still don't know about the virus, so that's not an exact number. And so, for example, one of the questions we don't know is that if you actually get the virus, how are you immune and for how long? We think you are immune, but we don't know the how long question. We're going to assume that in the magic vaccine, which we don't have yet, that if you get it, you'll be immune for a long time. Essentially, you would need about 70% from what we know now to achieve that. There's some different other estimates too that around 70%. And just keep in mind in terms of what percentage of people are actually infected. Even the more optimistic serology studies that indicate probably in California we're somewhere down around 4%, 2%. Even in New York City where they had all those cases, theirs was, and again, some people question whether that's accurate or not, but we're then talking 20, 25%, so a long, long away from getting herd immunity. So if we have a vaccine, we'd need to get probably 70% of people vaccinated before we can get to that point.
And then my follow-up is, and this is a question you've probably heard 10 billion times, but I think in today's day and age with this, it's good to bring it back up. I hear this a lot, Dr. Pan. Hey, listen, I don't want to get the vaccination. I don't know what the hell's going on with it, so I don't get it. If you're vaccinated and you're vaccinated and you're vaccinated, what do you care if I'm vaccinated? You're still not going to get it, so leave me alone. Why is that problematic? That's
problematic for several reasons. First of all, as amazing as a vaccine might be, it probably isn't 100%. There's nothing that's 100%. So, for example, let's just take the measles vaccine. You get your 2 doses, you are 98% protected. That's great. 98's really good. That's still 2% who aren't. For this coronavirus vaccine, which, by the way, does not exist yet. So we don't have a vaccine yet. People are trying different things. We don't have a vaccine yet. We don't know what percentage effective it is. So that's issue number one. The second part is that when you say, well, if everyone else gets vaccinated, why should they care if you're vaccinated? Well, then in which case you're really trying to take advantage of everyone else, right? Because they're protecting and you're hoping that all of them will protect you. And that's actually, if you're someone who's particularly has a problem with the vaccine itself, if you have a real medical problem for that, that's important that other people around you get vaccinated to protect you. If you can get the vaccine, and it's safe for you to get the vaccine, and you say no, what you're doing is you're putting someone else who may not be able to get the vaccine because they may be allergic to something in it or have some other problematic medical problem, you're putting them at risk. So because not everyone can get vaccinated. So again, we don't have a coronavirus vaccine. I don't know what who would be able to get and who wouldn't be able to get. I think certainly people try to develop the vaccine so everyone can get it, but some vaccines, for example, you have to be of a certain age, right? Even the measles vaccine, we don't give it to children under a year of age. So there's always going to be people who are out there who, whether for age or for some other potential medical condition or something, that may not be able to get the vaccine. And in order to protect them, the rest of us do need to. And so the other thing I should point out is that the reason I keep telling people that we're not going to get a vaccine in, it'll probably take 18 months. It's been a few months, so maybe a little less than 18 months, but that's only if everything goes perfectly, is because we need to do all the safety studies, okay? Any vaccine that comes out that's approved will have the safety studies done to ensure that it's safe for people to get it. And it will indicate for whom it is safe for people to get it. And those are the people who need to get that vaccine to help protect everyone else.
Dr. Richard Pan with us here on The Drive. I know everything right now is trying to gather information, research, just get as much intel as you can on what's going on with this virus. Are there tangible items that have been found on the differences between people that become asymptomatic and those that suffer, serious symptoms? Are there dividing lines, things that people can now take? Are we to that point yet in research?
Well, we're continuing to gather more and more information about this virus and this disease. And so, in fact, each week we probably know a little bit more about this. Unfortunately, perhaps the more recent thing that we're learning about this virus is not necessarily good news. So, for example, when we started out, I often said, well, it's the people who are seniors we have to worry about. Kids generally seem to be okay, right? And that's still true. Kids are generally more likely to be okay. Now I'm saying more likely. We've unfortunately seen some deaths of children who are under 10. So when we started off, there were no children under 10 who had died from this virus. The first few weeks, I think, when I was on the phone, unfortunately, we've now had cases of children under 10 who've died of this disease. It's still very rare compared to people who are older, but that's happened here in the United States. The other thing that's we've also learned is that there's this somewhat mysterious condition that is also happening in children that's similar to an autoimmune condition called Kawasaki's disease. That seems to be related to children who've gotten this disease. Again, very rare, but there as well. So we are recognizing that the COVID-19, for at least for some children, can be a very serious disease. And so that's something we have learned that we didn't know before. So I think that also indicates increased caution in terms of saying that it's okay for kids to just go ahead and get this disease because they'll recover and be just fine, because we know that while it's fairly rare, there are children who develop significant problems with this particular virus.
Dr. Richard Pan joining us. Doc, I'm going to try to mush together about 15 questions we have that are all in the same ballpark with my next question. I want you to talk a little bit as best you can about scientific and medical discovery. They say nobody likes to see the way laws and sausages are created, and you unfortunately are involved in both politics and medicine. You understand that more than anyone. A lot of people saying, how can we trust anyone? Dr. Fauci and all these guys, they said this model was going to happen, and then that model happened, and this number is off, and now that number is off, and how do we trust? These guys have been wrong from day one. These numbers have been completely off. Everybody's full of garbage. Could you maybe explain how discovery works and why these models were almost certainly always going to be off from the beginning?
All right. Well, let's start with the models are predictions with lots of assumptions, right? So I think I explained that earlier. That when you look at the number in the model, it's based on a series of assumptions to try to figure out what's going to happen. And as we get more information, we often can fill in some of the details that can turn assumptions into something that's based more on fact. So when you look at a model and it says we're going to hit so many deaths and so forth, they're making assumptions about, for example, what is the death rate, right? And we look at what's happened to date, and sometimes as more cases go out, we find out more information, so we have to make adjustments to that. We make assumptions about people's behaviors, right? And so, for example, the Washington model was actually based on assuming people stayed locked down, except we didn't, right? Some here in Sacramento and California, we generally did, but other parts of the country, we didn't. I also point out that the models, and I think if you talk to any scientist, they said the models often will help us in trying to figure out trends and things we need to do, but they're not exact predictions. It's kind of like predicting the weather. Anytime you try to predict the future, right? Anytime you try to predict the future, and there's lots of different factors involved, it's really hard to get it right on the nose, right? So, but it can often help you in terms of planning, in terms of trends, and telling you what different decisions may lead to what type of outcome. So it may not get the exact number, but it can give you trends, and that's why models are useful and helpful. So it's kind of like going to listening to the weatherman, right? They're right, they're wrong, and you can say, well, look, they're wrong a lot of the times. Why should I ever bother watching, the weather prediction? Because it does help you plan for whether you want to go have that picnic or what's going to happen to your crops if you're a farmer and so forth. So that's what the models help you with. Now, the other thing I should point out is that science and discovery really involves, again, continuing to gather data and drawing conclusions from that data. And the types of people you need to listen to, for example, Dr. Fauci, one of the things that he does is not only does he know a lot about viruses and virology, right? And so sometimes when he's saying things, he's filling in some of the gaps based on his knowledge of viruses in general, but we may not actually know specifically about the coronavirus. But he's also willing to say, look, I learned something new, so now I'm saying something a little different, and what I said several weeks ago was off or even wrong, right? So you have to be willing to admit that things change because you learned more information. That is the scientific process, all right? Because we don't have all the information right away. We can only base our decisions and our descriptions based on the information we have at hand. And then what happens is that hopefully, as we're gathering more data, we know more about it the next week and the week and the following and so forth. And I think one example is we just talked about today is that when we started, and it was based on the best information we had, I was telling you, okay, well, children, we think they're okay, right? We haven't had any death in any children under 10 because that's what happened when it first started in China. That didn't happen. Now it's like, well, unfortunately, that has happened, and we've now identified this new condition because as physicians were taking care of kids, they started to identify this new condition, which we're still trying to learn more about because now we have more information. So I understand that people want to have people come out and say, whether it's doctors or scientists, well, tell me exactly what's going to happen, and can you be really definitive right now, right?
Right.
What we can tell you is that we can tell you certain things now, and then if you want to know what's going to happen in the future, we can give you our best guess based on a knowledgeable guess, but it is still a guess, right? But it's based on what we know now plus sort of our best estimate based on looking at history or looking at other types of viruses and so forth.
Dr. Pan, this is probably more of an opinion question, but based on information that you have, we'll stick with California in our general area, are you comfortable with the guidelines we're taking now where there's a slow ease in, and is that a good plan in your opinion?
I think we're following a good path here in our local area. We need to continue to ramp up our testing, which we are doing. We're still not quite there yet, but we are making significant progress. It is now mid-May. I think my conjecture is that we kept going. Hopefully, testing-wise, we'll get there the next month and a half in terms of the volume of testing. So we have a good idea of who has the infection, who doesn't. We said we also need contact tracing as well, something that the state is working on. We are training over 10,000 contact tracers through the state, as well as, of course, local health departments. And then we need to have places to isolate people if they are positive and they don't have a place to isolate. And certainly we've identified hotels and other types of facilities to be able to do that. So we're making progress toward the things we need to do. That's to test, trace, and isolate to be able to give people confidence that we know who has the infection, and we're able to contain that. And then because of that, hopefully that will also give people confidence that when we do lift further restrictions on things, that people feel more confident to be able to go out. But we also have to continue to monitor the results of the things we're doing. So as we're talking about lifting certain things, we're doing more elective procedures, and I hate the word elective because some of these are pretty necessary. Things like people getting cancer treatments and other types of things in our hospitals because they have beds available. We're seeing some additional retail activity that's happening. But again, people still need to stay at home as much as possible. We need people to stay 6 feet away from each other when they're outside, so we're not infecting each other. Continue to wash your hands frequently. Said try not to touch your face because that's how the virus gets into you. We still need people to do all these things because that will help, again, prevent you from getting disease, or if you happen to have it and don't know it, prevent you from transmitting to other people. And then the other thing is I would do is encourage people to wear a mask because that will make it less likely in case you yourself do have the infection that you don't transmit it to other people.
Well, we always appreciate your time, Dr. Pan. You're very generous with that. We look forward to talking to you next week. Have a safe weekend, and we'll talk to you next week.
All right, thanks. Everyone stay safe.